Hopefully, you'll never have to deal with a real-life emergency situation, but if it does happen, we want you to know how to react. You could save that person's life. Firstly, make sure it's safe to approach. Check for a response. If there's no response, check for breathing. If they're breathing, put them in the recovery position. If they're not breathing, call 999 and ask for an ambulance. Also, get the nearest AED or automated external defibrillator. Start chest compressions by placing the heel of one hand in the centre of the chest. Interlock your other hand and keep your arms straight. Press down 5 to 6 centimetres at a rate of about 100 to 120 a minute. That's roughly 2 compressions for every second. Once you have given 30 compressions, if you know how to, give 2 rescue breaths. Alternate 30 compressions with 2 breaths. If you're not confident in giving breaths, then just give continuous chest compressions. Continue this until help arrives and takes over, you become exhausted, or the victim recovers, in which case put them into the recovery position. If an AED arrives, attach it and follow the instructions. Hopefully, you'll never have to deal with finding your child or baby unresponsive and not breathing. But if you do, we want you to know exactly what to do. Firstly, make sure it's safe to approach. Check for a response. If they're unresponsive but breathing, think about putting them in the recovery position. Shout for help. Can I get some help, please? Can someone call 999? Open and check the airway, making sure there's no obvious obstruction. If they're not breathing normally, give 5 rescue breaths. If there are no signs of life, start chest compressions. Place 2 fingers in the middle of the chest and press down about 1/3 of the depth of the chest at a rate of 2 compressions for every second. After 30 compressions, give 2 rescue breaths. Alternate 30 compressions with 2 breaths. If you are by yourself, give CPR for 1 minute, then call 999 or go for help yourself. Continue this until help arrives and takes over, you become exhausted, or the victim recovers, in which case put them into the recovery position. If you can't remember the difference between the child and the adult life support sequence, just use the adult sequence.